This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Strong bones, strong body. But as you age, you may find your bones aren't as strong as they used to be. You could be living with osteoporosis, a condition in which the bones become less dense, even fragile. The good news is there's medication to treat osteoporosis. But as we find out from Dr. Lee Aki at Delmarva Dental Services, that medication comes with a bit of a warning. Osteoporosis is common among older people, characterized by the loss of bone density. And that includes the jawbone.
It is very interesting how many people do not consider the jaws or jaw joints as a bone or joint like they do the rest of their body, like a shoulder, a knee, an ankle. And osteoporosis can affect all bones of your body.
In fact, Dr. Lee Aki of Delmarva Dental Services says the jaw is one of the most affected by the condition. And osteoporosis is not the only bone condition she looks for in patients.
So there are some cancers that can affect the stability of bone, particularly jawbone. There is metastatic breast cancer, metastatic prostate cancer, to name two. There is also a condition called Paget's disease, which is just almost like a bone deformity or creates abnormalities in the bone. And then cancers also such as multiple myeloma, which creates kind of like little moth-eaten appearances in the bone.
All of which can be picked up on x-rays. But Dr. Aki says sometimes patients are unaware of the problem.
Or maybe they're aware of their condition, but not aware of how it could be affecting their mouth.
Meaning cavities are only one consideration.
I think a common misconception would be that we're only looking for cavities, and that is really far from the truth because we are evaluating bone health, periodontal health, which means the stability of the teeth within the bone, but we're also looking for any abnormalities or pathology in the bone.
A common treatment for many of these conditions is bisphosphonate medication.
So what these medications do is essentially they alter the bone cells called osteoclasts, which help in the remodeling of the bone.
But Dr. Aki adds bisphosphonate medications can be problematic, especially with dentistry.
If you have infection or need dental surgery, that kind of thing, because you want certain remodeling to occur, and when you take these medications, that can hinder that.
Striking that balance relies on prevention on the patient's part.
It's important for everyone, but preventive dentistry, your regular cleanings, even if you just need a filling, a single crown, those things are not affected by your bisphosphonate medication. And in fact, maintaining your regular visits, getting your x-rays, keeping things healthy is a good way to avoid having infection or problems that may then result in a condition that needs more treatment.
If treatment is needed, it takes coordination between the dentist and the patient's physician.
And we may have to postpone the extraction because the risk of bone death around the extraction site is too high when they're on this medication.
Post-operative infection is another complication that could be made worse by bisphosphonate medication.
The bisphosphonate medication hinders the body's ability because its job is to stop that bone resorption. So you already have bad bone in this area where you've had a problem. And now the medication is saying, wait, body, we don't want you to heal this bone. We want to keep as much bone as possible. But that's not good bone. It doesn't have good vascular quality. It doesn't have good blood supply. And so you end up getting these dead pieces of bone that don't heal properly.
Dr. Aki says having any dental procedure, such as extractions, should be done before starting bisphosphonate medications, giving you a better shot at healing. And Dr. Aki says if you are taking bisphosphonate medications, call your dentist. If you're experiencing any symptoms such as pain, swelling, infection of the gums or jaws, or even loose teeth.